Neurocutaneous disorders. All right, let's dive into the neurocutaneous disorders. These are conditions where genetic mutations cause both neurologic and skin-related findings. Think of them as syndromes that connect the brain, nerves, and skin, often with tumors or vascular malformations. First up is Sturge-Weber syndrome. This is a congenital, non-hereditary anomaly of neural crest derivatives. It happens because of somatic mosaicism from an activating mutation in one copy of the GNAQ gene. The classic presentation includes a port wine stain, also called a nevus flammeus. This is a capillary vascular malformation that shows up as a non-neoplastic birthmark in the distribution of CNV1 or V2. On top of that, patients can have an ipsilateral leptomeningeal angioma, which often calcifies. That can cause seizures, epilepsy, and intellectual disability. Add to that an episcleral hemangioma, which increases intraocular pressure and can lead to early-onset glaucoma. This condition is also known as encephalotrigeminal angiomatosis. Next, tuberous sclerosis complex. This is autosomal dominant with variable expression. The mutations happen in tumor suppressor genes, TSC1 on chromosome 9, which encodes Hamerton, or TSC2 on chromosome 16, which encodes tuberin, or as some say, tuberin. Clinically, there are hamartomas in the CNS and skin, angiofibromas, mitral regurgitation, ash leaf spots on the skin, cardiac rhabdomyomas, intellectual disability, renal angiomyolipomas, seizures, and Sjagren patches. There's also an increased risk of subependymal giant cell astrocytomas and umbelfibromas. Then we have neurofibromatosis type 1, also known as von Recklinghausen disease. This is autosomal dominant with complete penetrance. The mutation occurs in the NF1 tumor suppressor gene on chromosome 17. This gene encodes neurofibromin, a negative regulator of RAS. The clinical features can be remembered with the mnemonic cyclops: café-au-lait spots, intellectual disability, cutaneous neurofibromas, Lisch nodules, those are pigmented iris hamartomas, optic gliomas, pheochromocytomas, seizures or focal neurologic signs, often due to meningiomas, and skeletal findings like sphenoid dysplasia or other bone lesions. Here's an easy way to recall. The name von Recklinghausen has 17 letters, which matches chromosome 17. Now, neurofibromatosis type 2. This is also autosomal dominant, but here the mutation is in the NF2 tumor suppressor gene on chromosome 22. The gene encodes Merlin, a tumor suppressor. The hallmark is bilateral vestibular schwannomas. Patients may also have juvenile cataracts, meningiomas, and ependymomas. Quick trick to remember: NF2 affects 2 ears and 2 eyes. Finally, von Hippel-Lindau disease. This one is autosomal dominant, caused by deletion of the VCHL gene on chromosome 3p. Normally, PVCHL helps ubiquitinate hypoxia-inducible factor 1 alpha, tagging it for degradation. When this system fails, tumors can develop. The classic findings include hemangioblastomas, which are highly vascular tumors with hyperchromatic nuclei in the retina, brainstem, cerebellum, and spinal cord. There can also be angiomatosis, bilateral renal cell carcinomas, and pheochromocytomas. The mnemonic is HARP: hemangioblastomas, angiomatosis, renal cell carcinoma, pheochromocytoma. Don't forget, VHL is linked with numerous tumors, benign and malignant. And here's another way to keep it straight. VHL has 3 letters, and it's on chromosome 3. It's also associated with RCC, renal cell carcinoma, which also has 3 letters.